about childhood malnutrition in Africa. Okay, so any place in the world could actually have issues of malnutrition. Even in the USA's, there are poor people. Do you understand? But this question was actually directed to Africa. So if you are watching this and probably you're not an African, you don't laugh at us. Okay, every place in this world have its own poor people. Now the question in full, they said that malnutrition is a significant cause of morbidity and mortality in childhood. So there has been an increased incidence of childhood mortality in Africa. What are the types of malnutrition? What are the risk factors and complications of malnutrition? What are the preventive measures? How can I prevent malnutrition? And what is the incidence of malnutrition in Africa? So for all of this, first of all, you give an overview of it. Okay, so childhood malnutrition includes undernutrition, like the child is wasting, stunting growth. I'm coming. Okay, micronutrient deficiencies. That one, the baby could be eating all those proteins, carbohydrate, but probably they are lacking in all those vitamins. Do you understand? Then sometimes overnutrition. So the baby eating too much too is also an issue. Okay, so we'll go on now to talk about the various headings. So they asked you to discuss malnutrition, but they gave you headings, so you don't go around discussing what you want. Okay, so what we have here is this. So undernutrition is wasting, things like wasting, that's low weight for height. Acute malnutrition. Stunting, that's low height for age. Okay, underweight, the baby just has a low weight, The baby is also lacking in micronutrients. So micronutrients are all those vitamins, minerals, ions, iodine, vitamin A, zinc, and all of that. Okay, the overnutrition, that's when you say the baby is what? Obese. Okay, baby is obese. Okay, so that one is mostly in the urban areas. So you give birth to your baby and you feel like to pamper them, you have to overfeed them and all of that. It could lead to issues. So what are the risk factors of malnutrition? So poverty and food insecurity. If you don't have good access to nutritious foods, that's a problem. Poor maternal health. Your mother is not even healthy to take care of you. Infections and repeated illnesses like diarrhea, malaria, all those illnesses we have in Africa. Low birth rate and prematurity. The baby was born before time. Inadequate breastfeeding. So maybe the mother did not practice exclusive breastfeeding for the time being. Then poor sanitation and unsafe water. Conflict and displacement disruption. So all those fights, just had to move out of the comfort of your home. Okay, and all of that. So complications of malnutrition, we have the immediate complications and we also have the late complications. Now for the immediate complications, it can actually weaken the immune system of the baby, and this can actually make it likely that it can have infections. The baby will have low glucose levels, their body temperatures are going down, electrolyte imbalance. Okay, and because your immune system is weak, you have delayed wound healing. Okay, delayed wound healing. Okay, so long-term effects now. It could lead to growth retardation. The baby will not grow to the normal height that they were supposed to grow. Cognitive impairment and school performance poor. That's poor school performance, right? So there's higher risks of a child that was malnourished to come and develop chronic diseases like diabetes, hypertension, cardiovascular disease when they become adults. Okay, and there's increased childhood mortality. The baby might probably die from that. So prevention measures is exclusive breastfeeding. So at least for the first 6 months of life, you should breastfeed your baby back to back. They call that exclusive breastfeeding. So balanced diet with proteins, vitamins, minerals should always be available. Micronutrient supplementations, iron, vitamin A, zinc should always be available. Immunization and infection control. Okay, then improve sanitation and clean water access. Then social protection programs just to reduce poverty and food insecurity. So incidence of childhood malnutrition in Africa is, according to UNICEF in 2025, Africa continues to face high rates of this. Okay, so around 30 to 35% of children that are under the age of 5 in Africa continues to face high rates of what? Malnutrition. Okay, they continue to face high rates of malnutrition. So that's for stunting. Okay, therefore muscle wasting, about 6 to 8% of children still suffer from muscle wasting, with higher prevalence in places that have been affected by conflicts. Okay, overweight, urban obesity rate. So 10% of children that live in urban places in Africa are actually being affected by this obesity. Okay, so malnutrition remains a leading cause of what? Childhood morbidity and mortality. So a lot of children are at risk. A lot of children are at risk. So with that, I think we come to the end of what? Childhood malnutrition in Africa.